Hi, it's Michael Hill here, and we're going to be talking in this short presentation on assessing 90-day stroke outcomes. So first of all, the reason why we do this is to assess how well our treatments are working. In particular for QuiCR, we're interested in understanding whether the emphasis on fast treatment times is making our patients better. And traditionally in stroke, we assess outcomes at 90 days after stroke onset, and so this discussion is going to be about how we do that. Typically, we use two scales to assess functional outcomes for stroke, and the rough time window is around 90 days, and we usually say plus or minus 2 weeks to accommodate patient schedules and clinic scheduling. The two scales that we use are called the modified Rankin Scale and the modified Barthel Index. The modified Rankin Scale is a functional disability scale. Strictly speaking, it assesses neurological functional disability. It's a very simple 7-point scale ranging from 0 to 6. It has been shown that it can be reliably assessed by telephone, and there are standardized structured questions that will aid in the simple classification of where the patient fits on the scale. On the right-hand side of the slide, you can see the explanations for each of the scale points. 0 means someone has no symptoms. 1, they have minimal symptoms, but they're otherwise perfectly well. 2, some symptoms, but they're independent, meaning they can live by themselves and manage their activities. 3 means they have symptoms and they can walk, and that could include walking with a cane or a walker, but they are dependent for some activities. For example, they might need help showering. 4 means they're dependent for most activities and they're unable to walk even with an assisted tool such as a walker or a cane. And 5 means they're bedbound and require essentially full nursing care. And 6 means they're deceased. So the ranges goes from perfectly well to deceased, and it's actually pretty straightforward when you talk to the patients to understand where they are in their symptoms. There are some standardized structured questions which allow a really easy classification, and in this slide I show you the standardized questions. So there are 6 of them, and they allow you to put the patient in the category starting from the worst possible outcome to the best. So the first is the patient deceased, and that's obvious. Then the second is, can they walk on their own? And then depending on the answer, you'll proceed to the third or the fourth question to try and differentiate whether they can walk with an aid or not, and whether they can do some activities or not. And then you'll be able to classify the patient in the various levels of disability from 2 through 5. The modified Barthel Index is a scale which actually assesses standardized activities of daily living in 10 domains, and you can see them listed in the example slide on the left-hand side. Originally, the scale was designed out of a score of 20, from 0 to 20, and each of these categories was put into 0, 1, or 2, or 0, 1 accordingly, and modification is simply multiplying that by 5 so that the scale gives you a score out of 100. It can also be reliably assessed by telephone, and it's very straightforward because these are standardized domains and they're very clear answers. For example, can you feed yourself? Yes or no. Do you need help cutting or spreading jam or butter, etc.? Can you get dressed by yourself or not? You can do some of it, but some needs some help, for example. So these are very clear, structured questions which are easy to get answers to, and it's very quick to organize and get a response. So typically what we do when you're assessing the outcomes is first, if you can, primarily you talk to the patient. Sometimes, of course, in stroke patients are aphasic and unable to respond, and so you would then discuss with a family member or a caregiver to be able to understand what the level of the patient's disability is. For the Rankin Scale, it's pretty straightforward. Just ask those questions on the form, and that form is going to be available for download from the QuiCR website. Similarly, for the Barthel Index, go through each domain and simply ask the questions, are you able to do each of those tasks? The outcomes really are best determined in person, so the in-person interview is ideal. But if it's not possible to get the person into clinic, or there are transportation issues, for example, then you can assess the outcome by telephone using the same approach. Primarily talk to the patient if you can. If not, get information from a family member or a caregiver. And with practice, our experience is that it's possible to get this information in about 5 minutes. So it's quite quick to do, and it gives us a reliable determination of the 90-day outcome.